Yes, 2 years ago, Joe Ray, a member of the executive committee of IACAPAP, had the idea to provide a free book, but not on a paper, online. Yeah. And he asked to authors all around the planet. They provided chapter, and it was a real success.
Yes, but now you move into education, you could say.
Exactly, because everybody knows now that there is a huge gap between the needs and the resource. And because there are new technologies, we can try to fill this gap with tools like the textbook. But the textbook is for high-level students. So we provide now a MOOC, a massive online open course, to give a culture about child and adolescent psychiatry for teachers, for general practitioners, even from parents. Then there is WHO, which provide the MHGAP project for primary care. And we have in the IACAPAP the ECAM project to teach child and adolescent psychiatry to pediatricians or to general practitioners. It has been proved by WHO that 80% of the needs for child and adolescent mental health are not provided. The first point, and the second point is that most research for evidence-based medicine are done in Occidental countries and not in low and middle-income countries. And we have first to give a culture about many people in many countries consider that child and adolescent mental health problems are not related to health, but are related to family, culture, etc. So we have to acknowledge that child and adolescent can have mental health problems. First, the culture. Second, we have to teach primary care and specialized care. This is classical training, classical at least now. First you have teaching with course, clinical cases, and after you have active training with quiz, with interrogation, with role-playing, with videotapes of patients that you evaluate, and of course you evaluate physicians or students before and after to be sure that they have learned something.
You have a full set of protocols or guidelines for mental disorders, for treatment.
Yes, this is ongoing. For the textbook, this is done. We are translating it in many languages, Spanish, French, Russian. The MOOC will be available at the beginning of 2016, and the ECAM will follow just during the 2016. We are in an emergency state, we have to do things. And so when you have to do things, when it is an emergency, you can go forward without asking too many questions.